guys, this is Dr. Blevins and welcome. Today we are going to talk about the difference between an ADHD diagnosis that your pediatrician might give to your child and an ADHD diagnosis that a psychologist might give. Again, I'm Dr. Blevins and I'm with Enilda Clinic at enildaclinic.com. So thanks for joining me. Okay, so let's get started. The first big difference is the time spent observing your child. And so as you know, whenever you go to the pediatrician's office, your appointment, depending on what type of appointment that it might be, could be anywhere from 15 minutes up to an hour long. Whenever you go to a psychologist and you get an evaluation done, the total time spent with your child is going to be anywhere from 4 to 6 hours. And so that's quite a bit longer. The second big difference is the types of measures that are used with your child. Whenever you get to the point of actually doing the diagnosis with your pediatrician, what I have personally seen, and I'm sure there's a big range of differences across pediatricians and even different types of pediatricians, but what I've personally seen from the people that I've worked with is that there's typically one rating scale used, and that type of rating scale is a pretty narrow type of rating scale focused on ADHD. And psychology, what we do whenever we're doing an evaluation, and the thing that takes up all of those 4 to 6 hours, is that we're doing many different types of rating scales, things that expand even beyond ADHD, and then we're also doing direct measures with your child. So we're capturing samples of behavior from your child. Okay, so let's go into a little bit more detail. So let's go back into observation time. What is the difference here? So when you're with your pediatrician, your child's pediatrician, and they're observing your child, many times you might find that the pediatrician requires that they kind of see the kid over several appointments whenever you're starting to bring up ADHD. This won't be true for all pediatricians. Again, this is generalization, and your pediatrician may choose to do things in a pretty unique way that I'm not aware of. But sometimes the pediatrician will want to see the child over multiple periods of time, and that's in order for them to get a sample of behavior that's consistent across the child's development and history. And so they really want to see that what they're seeing inside the room and what you're reporting to them that's happening across the home, across the school setting, wherever it may be, that it is really consistent and it's not just some sort of aberrant thing that's happening, just over the last month, something like that. And again, this is because they have a relatively short amount of time with you, and they don't have a ton of time to dig into that developmental history and figure out exactly how long a behavior's been happening, all those kinds of things, although many of them do. The next big thing that we see is that pediatricians are really required, per the American Pediatric Association, I might be saying that wrong, but their big association that's really setting guidelines for them, they're required to go through an intake interview with you where they are not just assessing for the symptoms of ADHD, but they're also really looking to see if there's any other potential reason for those behaviors that you're concerned about. So they'll be looking for medical reasons, which is 100% essential. And then they'll also be looking to see if there's anxiety, to see if there might be other reasons for the behavior, a tic disorder, whatever it might be. All of that's really important. But again, typically that full evaluation component is happening within one session for your pediatrician in that 15-minute to 1 hour span, unless you're going in for some sort of special appointment or with a special type of pediatrician, like a developmental pediatrician or something like that. Now, the difference here with a psychologist. So with a psychologist, we always start with an intake interview. This is where we're getting the developmental history, we're getting the presenting difficulties and a ton of extreme detail. Parents are often surprised at just how many questions I ask. I ask a lot of questions. And that's because, again, I'm held to the same standard that pediatricians are. I have to figure out if the things that are concerning to you as a parent are attributable to ADHD or are they attributable to some other concern? Oftentimes with young children especially who don't have the language skills to advocate for themselves, they may be experiencing some anxiety, which can lead to irritability. It can lead to fidgetiness. A lot of the things that people automatically jump to and say, hey, this looks like ADHD. And so it's my job to really dive in and account for all the observations the parent has to start to figure out multiple hypotheses for what could be going on with this child. Now the second part, the second part of the intake that's super important that's happening with a psychologist is that our observation rooms or our exam rooms are set up differently. So our rooms are much more child friendly. We have a variety of toys laid out. And so throughout this entire hour that I'm spending with you guys, the child is playing freely. And so this is allowing me to see if there's some other developmental thing going on with your child. I'm seeing how your child responds to you. So if you're giving them instructions, do they attend to the instructions? Are they able to complete a multiple step instruction? I'm also seeing how they respond to me. So as soon as the child walks in the door, I set up rules for them. That's really important because I want to see at what developmental level that child is at with the rules that I give them. It sort of starts to mimic, listen to me talk. It starts to mimic a classroom environment. And so if your child is easily able to respond to my classroom environment, that's giving me a lot of good information. Then the next thing is the exam. So with the exam, physicians are often using rating scales. In my experience, they're using pretty often the Brown ADD rating scale. Now, what I want you to notice about that is that if you come into your child's pediatrician and they say, and you say to them, you know, my kid doesn't pay attention, all they want to do is play video games, but then they can't load the dishwasher, and they're constantly forgetting their chores, they have such a hard time getting through homework because they're so distracted, they're so impulsive. So you're labeling all the symptoms of ADHD, right? And then your pediatrician hands you a rating scale that lists all the symptoms of ADHD. Of course, you're going to say yes to every item on that scale. That makes sense to me. The difference here is that for a diagnosis of ADHD, we have to make sure that there's no other reason why your child might be doing those behaviors. And so while it's great that you're endorsing symptoms of ADHD, we're giving a lot of weight to the fact that it could be ADHD, we have to make sure that it's also not something else. Now in psychology, what we do is we give a lot more rating scales. If any of you have ever been through a child psychological evaluation, you are super familiar with this. So we give a couple of big ones. These are what we call broadband rating scales. So these cover symptoms across a lot of different disorders, and that's intentional. Not that we think your child has those disorders, but because we really want to get a sample of what the parent is perceiving as a difficulty and what they're perceiving as not being a difficulty. Because if you come in and you're describing to me all those behaviors, but they're also starting to elevate for anxiety, now I have two hypotheses here for ADHD and for anxiety. And now I have to start to figure out, well, what is the true cause? Are they both? For instance, kids with ADHD, oftentimes our research suggests that they get a lot more constructive criticism, but sometimes that criticism is starting to really impact their self-confidence, their self-concept, and education especially. And so sometimes they'll start to have depression elevations as they're getting older. And so if I see that depression elevating too, that's another important thing that I want to look at. The second thing with the exam in psychology is that we're actually doing a direct measure with the child. And so again, we're going beyond just ADHD. So in the intake, if you're telling me things like he can't remember the instructions that I give him, that's telling me, okay, maybe there's memory difficulties there. If your child has difficulty reporting to you information and you're thinking, well, that's ADHD, right? Well, maybe that's actually some language difficulty. And so depending on how many things you're telling me that, and I'm in my mind, categorizing that into different domains, I'm going to actually build a battery of assessments, and I'm going to test your child to see, are there language impairments? Are there memory impairments? I'm going to test their overall thinking skills, and then I'm going to test their flexibility in thinking, their impulse control, their attention skills, their academics. There's a huge variety of different domains that I can assess, and what I do is I compare each of those domains to where other kids your child's age score. And so then I get an idea of where those true deficits are. Because even if we say your kid has ADHD and that's the final result, you'll want to know, well, where specifically are my child's deficits? And so that kind of brings us into the next little bit here of the difference between a pediatrician's diagnosis and a psychologist's diagnosis. Whenever you have a pediatrician's diagnosis, another recommendation for pediatricians is, depending on the age, for 4 and 5-year-olds, the recommendation is behavior therapy. And then for 6-year-olds and up, the recommendation is certain types of medications and then behavior therapy. Okay, but for psychologists, what we're doing in our recommendations is we are taking that information from the intake, so the context of your family life, and then we are taking the scores that we get, so the specific deficits of the ADHD. So if it's cognitive inflexibility, or if it's poor sustained attention or selective attention, if it's impulsivity, whatever it might be, your child will be unique in their presentation of ADHD. If your child, in addition, is experiencing some depression, then we also add on recommendations for that as well. And so the psychologist recommendations are more about the very unique presentation of your child, and they're geared towards therapy and interventions for the home environment, the school environment, the life that you live based on what you've said in the intake. Now, what I always do, and what I know many psychologists do, is we always add in a recommendation for the pediatrician. So, for instance, if I have a kid who has ADHD, I want that pediatrician to know if that kid has anxiety or depression, because that may be very important for that pediatrician whenever they're selecting medications to help that child. Certain medications may kind of exacerbate the anxiety and actually make the child look like they're having even worse ADHD. So it's really important that the pediatrician understand all the different symptoms that the child is having. And that's what a psychologist evaluation can do. Okay, so those are the big differences from beginning to end. I hope that you enjoyed this video. If you'd like to learn more, please go to enildaclinic.com. Be sure to sign up for the email list. Be sure to talk to your child's pediatrician if you're having concerns about your child with ADHD or with anything else, okay? Because this is just a learning video. All right, thanks so much. Bye.